Well, 5 years ago, we were in the middle of a statewide stay-at-home order in order to crush the curve, to slow the spread of the novel coronavirus. But about a year into the pandemic, after a vaccine had already been rolled out in record time, people were still kind of looking for alternatives to treatment and prevention. Because of politics and misinformation, Ivermectin became the covert COVID remedy. Remember during the summer of 2021 when we showed you the empty shelves at the local D&B supply of where they usually stocked the horse dewormer paste? Well, they were getting a run on it because, well, it was ivermectin, and the anti-parasitic antidote wasn't a medically approved method to treat COVID, and pharmacies were denying prescriptions, so people just went there to see if they could buy it themselves. However, many were still getting those prescriptions filled from doctors like Garden City pathologist Dr. Ryan Cole. Dr. Cole was later reprimanded and had his medical license in Washington suspended for 5 years for doing such things. Well, ivermectin still isn't an FDA-approved treatment for anything other than infections caused by parasitic worms, but that hasn't stopped Idaho lawmakers from, well, wanting to make the drug or make sure it can be available to anyone, anytime, over the counter, right, Aspen?
Yeah, this is the same idea that we've seen passed in the state of Arkansas and Tennessee. Now Idaho wants to be the third state to make this legal. In the bill hearing today, Senator Kelly Anthon, the sponsor of this bill, argues the drug is already available over the counter in countries around the world. He spoke about its low risk of addiction and affordability and says that its accessibility is crucial for millions of people who rely on it for diseases that are preventable, especially in low-income populations where there's limited health care resources. But today, pharmacy representatives raised concerns about making the drug so accessible. Pam Eaton with the Idaho State Pharmacy Association says over-the-counter medicine is safe and effective when you follow the directions on the label. And right now, the drug is not yet being manufactured to be sold over the counter.
Until the manufacturers create this as an OTC and has all of that labeling on it, there's no way for a pharmacy to truly put it out and sell it as an OTC.
Senator Anthon responded by saying this bill doesn't mandate the sale of ivermectin over the counter, but makes it possible to do so if and when manufacturers get proper labeling. Anthon also thinks if the bill passes, quote, entrepreneurial companies could find ways to include labeling and warnings with the drug. He gave the example of adding a piece of paper with such warnings into the box with the drug, and then they would sell it to pharmacies. Now, Senator James Ruckte voted no, suggesting political motivations are driving the push for this bill.
Political reasons are not a good basis for making a decision to make a prescription drug an over-the-counter drug. That decision should be driven by the science. It should be driven by data and research, and we have none of that in front of us.
Senator Anthon says that's not why he brought this bill forward and that his constituents are pushing for better access to this drug. Now, Ryan, this narrowly passed out of Senate this morning, 4-3 vote. There were also concerns that committee members wanted to hear from a doctor before pushing this forward. Sure. It is late in the session, so we're kind of getting down to that debate of do we do this session? And
we did not hear from a doctor today on this.
We did not hear from a doctor today on this.
So explain how this works to me, Aspen, because for years, and we've all been told this, only the FDA can approve things for over the counter. Is that correct?
Right. That's not right. Non-approved FDA products can be sold over the counter. So that example of if now states are going to pass this and say we can sell it over the counter, you're going to see some of these manufacturers going to do that.
It just won't have that FDA seal of approval.
Right. It will not have the FDA approval. So, you know, when that happens, you have warnings from the pharmacy. Sure. Now, if it was sold over the table, they're kind of relying on people going up to the pharmacy and asking questions about that if they're going to get it over the counter.
Okay. All right. Thanks, Aspen.